Hi, I'm Dr. Kingsley Chen, board certified orthopedic spine surgeon. I'm here with Rahul, who is an engineer. He is with Inspan. This is a company that has, I believe, the most innovative device for spinal fusion. I have been fortunate to be a co-inventor on this device, and I'm here to show you how it's implanted. But first, before saying that, I think it's time for a new paradigm in lumbar spine fusion. Pedicle screws, inner bodies, full laminectomies have not had consistent results across the world. It depends on the device you use, it depends on the surgeons. So this device, I believe, is a simpler option that can be used anywhere in the world, and that's what drives us. This is a simple device that is effective, and we think will remove the risk from lumbar surgery. In addition to that, the results over the last 10 years of this device has proven itself. So let's talk about the steps to implant this device. It is very simple, and this surgery should take you less than 1 hour, can be done in an outpatient setting. First thing you do, obviously, make an incision and expose the back of the spine. Now, this is a sawbone, so you can see the entire spine. What we then do is the option of, if the spinous processes are kissing, to penetrate between the spinous processes with this device. Alternatively, you could take a leg cell. You could then bite between the spinous processes. You may take off some of the spinous processes, the ligaments in between, and all the way down to the ligament of flavum. Take some of the bones off. That's called a hemilaminectomy. That's an open decompression of the spine. You can go further and achieve even more decompression with other instruments. Once you've exposed the space between the spinous processes, what you'll do is take this instrument. This instrument will open the spinous processes to the desired amount. So you squeeze, and as you squeeze, it clicks and opens the spinous processes. You then read off the top of here what is the size of that space. That is the implant that you'll choose. You remove this and you choose the appropriate implant. Here's the implant. It's attached to this inserter. It allows you to open the implant up as much as this and go down, squeeze the implant together. Or if you want to keep it closer together, you close the space, you put it down. As you get down, the implant is designed to contour against the lamina. That's one of the features that's unique. You then hammer it in all the way down onto the lamina. It won't go any further than the lamina. At this point, you take a compressor and you compress against the inserters to allow the implant to be stable. Once you have the stable implant, you will lay this down on the skin, or your assistant hold it. You take a second compressor, and the goal here is to attach a compressor against the implant. The implant has these holes that are designed for this instrument to fit within the implant. Once you have it, you can squeeze the handles together and lay it down against the patient. So now you have the implants fairly secure. You can remove the first compressor and the implant stays right there. You turn this compressor around, you close it to get it inside the wound. The idea is to try and access those holes on the implant. That way it's stable. Once you have both compressors on, you are now able to compress this device fully against the spinous processes. This is very important because in order for this to be fully fixated, you need the teeth to engage the bone. And by squeezing against the implant, the teeth are going to be fully into the bone. Once that happens, this device will not loosen. This is now fully secure. You can just hold that. You can now remove the inserter. It's designed to come off very easily. You can now fixate the screws so the implant will stay where it is, and one click, 2 clicks, That's all you need. You repeat it on the other side. That's enough. Now that the implant is in, you can take these compressors off. That implant is now secure. So you've just seen a demonstration of a very quick procedure to fixate the spine. This spine is now fully stable. One of the benefits is that even though it's fully stable, you can still get some amount of compression in the front. We think that's going to decrease the stress on the adjacent segment. With traditional pedicle screws and interbodies, the spine is very stiff, which means that your risk of an adjacent segment breakdown is very high, up to 36%. We hope this is educational, and follow us on www.inspanfixation.com to learn more. Thank you.